Today we're going to be discussing vital signs. This information can be found in Chapter 33 of your textbook. Vital signs reflect the function of three body processes: regulation of body temperature, breathing, and heart function. The vital signs of bodily function are temperature, pulse, respirations, blood pressure, pulse oximetry, and pain. Vital signs should be measured during physical exams, when the person is admitted to a healthcare agency, before and after surgery, procedures, and tests, after a fall or other injury, when medications affect the circulatory or respiratory systems, and as stated in the care plan. Multiple things can affect vital signs. For instance, activity, a patient's age, anger, anxiety, medications, whether or not the patient is eating or drinking, exercise, fear, sleep, pain, noise, illness, smoking, stress, the weather, and a patient's weight. Body temperature is the amount of heat in the body. Heat is produced and used by the cells for energy. It is lost through the skin, breathing, urine, and feces. Body temperature is fairly stable. It is lower in the morning and higher in the afternoon and evening. Body temperature is the balance between the amount of heat produced and the amount of heat lost by the body. The word fever means elevated body temperature. Febrile means with a fever. Afebrile means without a fever. There are a couple different sites that temperatures can be measured. Oral temperatures are not taken if the person is under 4 to 5 years of age, is unconscious, has had surgery or injury to the face, neck, nose, or mouth, is receiving oxygen, has an NG tube, is restless, confused, or disoriented, or if the person has a seizure disorder. With oral temperatures, the thermometer is placed under the patient's tongue. Next, the rectal site is used for infants and children under 3 years of age. Rectal temperatures are not taken if the person has diarrhea, has a rectal disorder or injury, has had rectal surgery, or if the person is agitated or confused. Next, you can take temperatures in the ear, the tympanic membrane thermometer. The tympanic membrane has fewer microbes than the mouth or the rectum. This route is comfortable and not invasive. The site is not used if the person has an ear disorder or ear drainage. The forehead is known as the temporal artery site, and an axillary temperature is taken under the arm. The axillary site is less reliable than other sites. It is used when other sites cannot be used. Do not use this site right after bathing. This chart displays normal body temperatures. So for oral temperatures, the normal range in Fahrenheit is 97.6 to 99.6. Rectal, the normal range in Fahrenheit is 98.6 to 100.6. Axillary, the normal range in Fahrenheit is 96.6 to 98.6. The tympanic membrane, normal is considered 98.6, and the temporal artery, normal is considered up to 99.6. So we have the standard electronic thermometer. That's what you'll most likely see in the hospital. It's battery operated. The probe is inserted at the measurement site, so it can be oral, rectal, or axillary. Oral and axillary probes are blue. Rectal probes are red. Probe covers are disposable sheaths used to prevent the spread of infection. Apply a new cover for each use. This is a picture of a tympanic membrane thermometer. It's just placed in the person's ear to read the temperature. With the tympanic membrane thermometer, the probe is inserted into the ear canal. The ear is pulled up and back, just like it's shown in the picture. This is a picture of a temporal artery thermometer. It goes across the person's forehead. This is a picture of a digital thermometer that can be used orally, rectally, or axillary. When using it orally, the thermometer is placed under the tongue and to one side. The rectal temperature is taken with the person in the Sims position. The buttock is raised to expose the anus. And this picture shows an axillary or under the arm temperature. The thermometer is in the center of the axilla, and the person's arm is over the chest. Pulse is the beat of the heart felt at an artery as a wave of blood passes through the artery. The pulse rate is the number of heartbeats or pulses felt in a minute. The pulse rhythm should be in a regular pattern. The pause between beats is the same. An irregular pulse is when the beats are not evenly spaced or beats are skipped. Force relates to pulse strength. A forceful pulse is easy to feel. It is described as strong, full, or bounding. Hard to feel pulses are described as weak, thready, or feeble. The apical and radial pulses should be the same. Sometimes the heart contractions are not strong enough to create pulses in the radial artery. Then the radial rate is less than the apical rate. Heart disease is a common cause. To see if the apical and radial pulses are equal, 2 staff members are needed. Taking the apical and radial pulse at the same time is called the apical radial pulse. The pulse deficit is the difference between the apical and radial pulse rates. A picture of where the apical pulse is located is on the next slide. Tachycardia refers to a rapid or greater than 100 beats per minute heartbeat. Bradycardia is a slow heart rate, or a heart rate that is less than 60 beats per minute. This picture here shows the front of a patient's chest and where you would put the stethoscope to count the apical pulse. The pedal pulse is used to check blood flow in the foot. The pedis artery is over the foot bone. This picture just shows a variety of different sites where you can check a patient's pulse. Respirations refer to breathing air into and out of the lungs. Into the lungs is inhalation, out of the lungs is exhalation. The healthy adult has about 12 to 20 respirations or breaths per minute. Blood pressure is the amount of force exerted against the walls of an artery by the blood. Systole is the period of heart muscle contraction. That's when the heart is pumping blood. Diastole is the period of heart muscle relaxation. The heart is at rest. Normal blood pressure, systolic range is 90 to 120. Diastolic range is 60 to 80. Some factors affecting blood pressure are that it increases with age. Women usually have lower blood pressures than men do. Family history, blood volume, stress, pain, exercise, an individual's weight, their diet, medications, positioning, smoking, and alcohol use also affect blood pressure. This is pulse oximetry, and it measures the oxygen level in the blood. On the left side of the picture, it says SpO2 and 97. That is the oxygen. Normal is 92 to 100. On the right, it says PR, BPM, and that's the pulse rate. So that person's pulse is 72.